Good morning, candidates. I'm Siti NURFARZANAH, the CEO of this hospital, and here with my assistant that will assist our interview session for today.
Welcome to all candidates. For our program this morning, we will be divided into three parts. The first part would be the introduction part, where all of you would be given the opportunity to tell us about yourself. The second part would be us asking you some random questions to help us evaluate your weakness and strength. And the third part would be us allowing you to ask us any question that would be relevant for any of you if you are interested to working in our hospital.
So let me know, each of you by telling a bit about yourself and your background, and which part of your background closely aligned with the role you have applied today. So we can start from candidate 1.
Assalamualaikum and a very good morning to the respected panel. First of all, I would like to thank you for inviting me to this interview. It was truly honored to be invited here. So I am a fresh graduate student from UNIKL RCMP, pursued Bachelor in Nursing Science. Before that, I've completed my foundation in Life Science in University Malaysia Sarawak, which is UNIMAS, and my secondary education in RCMP in Science stream, where I obtained both of my SPM and also IGCSE certificate qualifications. Other than that, I believe that what aligns me to this nursing role is my involvement in this healthcare field. For instance, I've worked as a part-timer during my bachelor program as a paramedic under MK Ambulance. I've joined an event which is trail and also marathon event under that company that give me an early exposure to emergency care and also first aid kit. Other than that, I also serve as an honorary treasurer in my high school. Back in my high school, I have raised a fundraising event and also a CSR event to a single mother home and also mosque. So from the experience that I've gained, I believe that this role is very suitable for me and I have the quality to suit to your hospital. That's all from me. Thank you.
Okay. Thank you, candidate 1. So now we move to candidate 2.
Thank you. Good morning. Thank you to the panel. Thank you for choosing me to attend this interview today. I feel so grateful to be here today. Firstly, my name is FITRAH binti MAAROP. I am 24 years old. I am freshly graduated as a nursing degree from UNIKL RCMP, and I was taking Bachelor of Nursing Science. I recently graduated with my nursing degree. Throughout my degree, I actively joined any volunteer and actively volunteering as a OSCE helper, and I also complete my clinical rotation at the ward, as in ward mental health, community health, pediatrics, and other. This experience gives me hands-on practice working as a healthcare team. In addition to my clinical, I also work as a part-time throughout my degree. That really gives me experience and helped me to enhance my communication skills, multitasking, and how to manage stress. Lastly, what I believe mostly align this closely on this role is my compassion, my work ethic, and willingness to keep learning. Lastly, I feel so excited to join as a nurse and contribute to this team. That's all from me.
Okay, thank you, candidate 2. Now we go to candidate 3.
Assalamualaikum. Good morning and thank you for having me today. My name is Muhammad QAYYUM. and I am a fresh graduate from UNIKL Royal College of Medicine, PERAK, with a Bachelor of Nursing Science honors. Previously, I was graduated from College MAAROP with matriculation of Life Science. In my high school, I was graduated in RCMP transfer. So during my studies in UNIKL RCMP, I have joined a volunteering event such as OSCE Helper and World Skills Competition. When I joined the as helper, I gained a lot of experience, and that developed my teamwork and communication skill. Lastly, I am very honored and excited to be interviewing for this role as a staff nurse at this hospital, as I know this hospital has achieved a lot of achievements. That's all from me, thank you.
Okay, thank you, Candidate 3. Next, we move to Candidate 4.
Assalamualaikum and good morning. My name is NABILAH binti ABDULLAH. First of all, I want to say thank you to panels and also to the other candidates. Again, my name is NABILAH binti ABDULLAH and I'm graduated from UNIKL RCMP in Bachelor Degrees in Nursing Science. During my previous clinical posting, I have assigned in many departments such as emergency departments, pediatric care, and also surgical departments. With this previous experience, I have handled many situations that is high-stress environment, and from this experience, I learned how to manage my stress level and also how to manage time properly. And during the clinical posting, I realized that not only we as a nurse need to provide care to the patient, but also we need to give our heart to them, and also we need to give care to them with sincere and also honest. Other than that, I believe that this profession need someone who is very responsible. During my foundation year, I was one of the public welfare and social ESCO. I have handled many events, and I've also managed to care about students' welfare, and this aligns with this profession that needs to care about other people. And the reason why I chose this hospital as one of my choice is because this hospital is excellent in as one of the teaching hospitals and have great technology about the patient-centered care. Thank you.
Okay, thank you, Candidate 4. So now we go to the last candidates, Candidate 5.
Assalamualaikum and good morning to the panel and my fellow candidate. Thank you for the opportunity to be here. My name is ZULAIKHA binti Abdullah, and I'm graduated with nursing degree at University Kuala Lumpur Royal College of Medicine, PERAK. I am someone who very passionate about being care for others. So I believe that nursing is a perfect fit role for me, both professionally and personally. During my studies, I've completed my clinical rotation in various departments such as pediatric care, medical surgical units, emergency, and many others. And I believe that that helped me develop my adaptability and versatility qualities, which I think is very important for this role. As for what aligns the close of for this role is my ability to work in fast-paced environment while maintaining patient-centered approach. I understand that for this position, I cannot only depends on my clinical competence. I also need to have interpersonal skills and teamwork. And I believe that from my background, I already met those demands. Last but not least, I'm someone who eager to continuously learning. As we all know that in healthcare, there will be a new protocols and technologies that will be emerging from days to days. That's it.
Thank you, Candidate 5, and thank you to all candidates. So now we will move to the next part, which is part 2.
Thank you, Miss. So we're going to jump straight to the part 2 of this interview, which this round I'm gonna ask you one question each for 2 rounds. So for candidate 1, could I ask you what is your strength to work under this field? You may answer.
Thank you for the question. So, what is my strength to work in this field? I think the first one is my communication skills. I am neither introvert or an extrovert person, so I would say that I am ambivert person because I manage to suit in the situation, to cope in the situation that happened at that time. For instance, if that situation needed me to give out my opinion, I wouldn't hesitate to stand out for myself. So I think this would help me to cooperate well with my colleagues and also to click with my patients. Other than that, I am also fluent in Bahasa Malaysia and also English, and I know a basic Mandarin language. So this wouldn't be a problem for me to interact with many diverse patients in our hospital. So moving on, another strength that I think I have in myself is I am a very empathetic person. This can be proved by a real life situation that I face. This is a little bit personal, but I would like to share this experience. At the age of 16, I've lost someone that I truly treasured at that time, which is my mom, during my examination week. So along the way, I carried the grief throughout my high school years, and at that time, I do feel lost. But after a while, I do rediscover my passion and also my purpose of life, especially during my degree year. So that's why I am very eager to pursue in this healthcare field. So this situation also shows that I can remain calm as a person, even though I was facing the lowest point of my life at that time. So I think that's all from me. Thank you.
Thank you, candidate 1. So we're gonna go to candidate 2 now. So candidate 2, can you tell us what is your weakness and how do you tackle it? You may answer now.
Thank you, sir, for asking me. Firstly, one of my weakness is how I tend to get very nervous, especially in unfamiliar or in unfamiliar station. As a student, I would always hesitate and second guess myself if I need to do something because I was afraid of doing any mistake. But over time, I learned how to manage it better. Firstly, I will remind myself that feeling nervous is natural and it's okay to feel nervous. Especially in healthcare, where every detail is mattered. Then it's okay to do wrong and don't need to feel nervous. And then, in my clinicals, I will prepare early and review the procedure early before the clinical. And if throughout the clinical, if I don't understand and I have questions, I will ask that time. So I will feel more confident to walking in. And then, if I feel nervous at that time, I will practice. I have learned to practice on deep breathing technique and positive self-talk to myself that to help me calm my mind. I think that's all from me.
Okay, thank you, candidate 2. So candidate 3, your question is, what is the most challenging project you have worked on and why you consider it as the most challenging project you have done? You can answer.
One of the most challenging projects I have worked on was during an OSCE in 2024. As a student, I had to assist in the clinical station for the examination of the student in UNIKL RCMP. So it was challenging because I had to communicate with the other lecturer and the other helper. Other than that, I was a Sem 1 student at that time, so I don't even know any single thing about OSCE. So with the guide of the lecturer, I could manage to be a helper in the OSCE. I also had to multitask and work under a little bit of pressure, I would say. However, although it is challenging, it taught me a lot on the importance of communication skill, teamwork. Yeah, that's all from me.
Thank you, candidate 3. So, candidate 4. What do you do if you feel unmotivated to pursue your work as a staff nurse? You can answer.
Thank you, sir. Thank you for the question. Okay, for the question, what makes me feel motivated?
What makes you feel unmotivated? And what do you do if you feel unmotivated?
To answer your question, what makes me feel motivated if I feel unmotivated is that by seeing patient recovery during their toughest moment. By saying this, I believe that I'm very grateful to see the patients feel gratitude, and also I know that by seeing people recover, I know that I have contributed to their healing process, and by seeing the process, I know how uncomfortable it is to be sick and to be bedridden all the time. And I can see that if I get a simple gratitude from the patient and a simple thank you, it makes me feel very motivated, and also it makes me feel very better. And what makes me want to continue being a nurse is that actually I enjoy learning new skills every day from the hospital, and also from the clinical instructor and with the seniors. By learning new skills every day, I feel like there's many more things I want to learn in this work. Other than that, being in this industry with supportive friends and also supportive seniors, I get this strength to continue in this profession by being supported by many people. That's all.
Thank you, candidate 4. Candidate 5, your question would be, what is your strength that could extend the teamwork? You can answer now.
So, I think one of my main strengths in teamwork is my willingness to listen and learn from others. During my clinical placement, I've worked with many nurses, doctors, and other healthcare professionals, and I quickly realized that how important is clear communications and mutual respect are for effective teamwork. I'm also naturally a good listener, I'm naturally a good listener, so it helps me to understand my teammates' perspective and for me to respond accordingly. This is just to share my experience during clinical placement. I've worked with a nurse who has very busy schedule, so she has no time to accommodate to us student nurse. So we offer to help her with patient documentations and basic care and other basic care tasks. I realized that this could help us as a student nurse This could help us to work in teammates more effectively. I believe that being supportive and proactive like this can enhance teamwork and improve patients' outcome. That's all.
Thank you, candidate 6. 5.
Okay, that's all for part 2. So now we will go to the last part of our interview session.
Continuing on, from this point onward, I'm gonna go with random candidate, okay? So, can we go with candidate 4? The question would be, how would you approach a task I have never done before? You can answer me.
Thank you, sir, for the question. If I were assigned a task that I've never done before, I will check it with the procedure manuals, online sources, and also the protocols. If I need any clarification, I will seek help from the senior nurses and also any other colleagues. Since my top priority is always be the patient safety, I will make sure that I will fully understand the procedures before I perform it for the patient. From my previous experience, during my clinical posting, we have learned our lessons because of not checking the manuals properly and not clarifying with the senior nurses. So I would say that by approaching with the manuals and also the protocols, I will prevent bad things that happen to the patient. That is all from me. Thank you.
Okay, thank you, candidate 4. Can I ask candidate 5? How do you handle teamwork with a difficult teammate? Your answer.
Thank you. As for if I ever have to work with difficult teammate, I will remain calm and professional. I will focus on maintaining a clear and respectful communications by finding a common ground, which is our both share goals that we need to care for our patients. If needed, I will try to speak to them privately. If needed, I will speak to them privately without any confrontational, so that I could understand their perspective and efficiently shares mine. If that doesn't resolve it, if that still doesn't resolve it, I will ask advice from senior staff and also any mentor that could give us solutions that would maintain the positive team environment. So during my clinical placement, there is situations where a team members of mine, she was a quiet, reserved, and hesitant to share her opinions or information. So I made an effort to build trust by being approachable and encourage open communication. This eventually improved our teamwork. So I believe that with empathy and professionalism, any conflicts can be resolved constructively. That's all for me.
Thank you, candidate 5. Candidate 2, your question would be, how do you handle a patient who refuses the treatment? You can answer.
Thank you, sir, for that question. If a patient refuses to accept for the treatment, firstly, I will try to take time to understand why they refuse the treatment. And then, as a nurse, I will listen carefully and non-judgmentally why they reject the treatment, either because of their cultural belief or because they fear any risk or they have bad experience of that treatment. But as a nurse, I will educate them about the treatment. I will try to convince them by telling them the benefits, function of the treatment, and tell them the risk of not taking the treatment. And then ultimately, I respect their decision, their right, because they also have the rights to make decision on their health. So I will respect their decision, their right, even they decline that treatment. That's all.
Answer candidate 2. So, candidate 3. What would you expect yourself in 10 years under this plan?
Thank you for your question, sir. So, in 10 years, I see myself as an experienced and highly competent nurse, specialized either in emergency nursing or critical care. Other than that, I would love to be in mentoring role or in a leadership to guide the junior nurses, so they would not do the same mistake like what I make during my time as a junior nurses. Other than that, I also aim to pursue further studies, either in master, or if I have chance, I will continue in PhD and being a lecturer and also contribute to UNIKL RCMP. I would love to be lecturer in UNIKL RCMP and to give education to the future nurses to be good nurses in the future. In conclusion, I want to be someone who not only be excellent in healthcare only, but I want to give a positive impact to our healthcare institution. That's all from me. Thank you.
Yes, thank you, candidate 3. And last but not least, candidate 1. Your question would be, how do you comfort an anxious and emotional patient? You can answer.
Thank you for the question. When comforting anxious or emotional patient, as for me, I believe that it's always the small things that we do for others that can make the big impact for them. So I will start by giving them comfort and also make a safe place or a calm environment for the patient. Even by the small gestures such as holding their hands or ask them how they feel, I believe that can make them feel valued and be seen. Other than that, I am aware that patient comes from different backgrounds, and also maybe they have a different past experience or traumatic events that they have gone through in their life. Especially for the youngsters, it might be their first time admitting into the hospital. So it is our responsibility to provide them a comfort for them to make them feel safe, to be surrounded by us nurses. Even in my CSR activities, my experience back then, I have dealt with people that during their vulnerable situation. So from that, I learned how to handle that situation and deal with that people. Also, I'm aware that this field wasn't all rainbows after all. So even if I needed to face with any situations of patients, I am fully ready and committed to work in this field because I have chosen this path. Thank you.
Thank you also, candidate 1. So that would conclude our trivia question session. So we could go forward with the last session for today. So if any of you have any question for us to answer, you may ask now.
So I want to ask, how is the rotation of nurses assigned in emergency department? Like, is it rotated through the departments or how? Can you explain more to me?
Now I will let our CEO answer that. Please.
For that question, how our shift rotate in emergency department. So in our hospital, the nurses in emergency department rotate between only between them, because we have our specialist nurses that have post basic to enter the emergency department. But in case we shortage of nurses, we will call nurses from other department. That's the only emergency case. Thank you for the answer.
Thank you for your answer.
Any other question? Candidate?
I have. So I want to ask about what are the most common challenge that your nurses face here, and how does your team address them?
Okay, good question, candidate. Well, for the most part, all of us are working together as a team. So, whenever our teammate feel overwhelmed, you can ask for others to help you out. Fortunately, our hospital has never had a problem with understaff. Thanks to that, if any new nurses come into our hospital and you have any problem, you can ask the older seniors for guideline. And if you still feel overwhelmed, you can always come to us to ask any support or any thing that's troubling you. I hope that answers your question. Any more? Well, thank you.
That's a wrap for our interview session for today. But before that, give us some time to conclude and discuss a bit about our interview session. Okay? Thank you. Okay, after some time, Hakimi, the Human Capital Manager, and I have seen and discussed about all the response, and we congratulate candidate for Nur ISMAH Nabilah binti Abdullah because have been fulfilled our interview criteria, and please to let you know that you have the possibility to be selected for this role in our hospital. Further information we will email to you.
Thank you for the CEO and also the human capital. I'm very grateful for this position, and I also want to thank you, all of you, for today's session. And I'm looking forward to work with you. Thank you.